In terms of pain points, I mean, the industry is filled with pain points. There's pain points in you know everything on the payment side. There's documentation is a huge pain point. Staffing levels are a huge pain point. Um, you know, it's a tough time for hospitals right now. As much business as they have from COVID, they have seen most of their business that's not COVID go away, and a lot of them are losing a lot of money. So there's quite a lot to fix in healthcare. There's no shortage. Healthcare was already changing and already adopting technology. However much it's slower than a lot of other industries to adopt technology, in some part for good reasons. Um, and there were a lot of changes going on before COVID hit. Mostly in the or largely prompted by the fee for service value based care kind of trajectory that we're seeing. But this last year, the big news is that telemedicine has become, the regulations eased on telemedicine, and it's become very important. And I think that's not going to be reversed in the future. And there have been a lot of companies that have taken advantage of that change in the law and change in the way people interact with their doctors. Sure. I mean, as I said, computer vision is already being used for imaging, so reading X-rays and other imaging reports, and these could become really, really good. I think they're pretty good now, but if you imagine a machine that's been trained on a few million or 10 million X-rays, they might be able to do a pretty good job in helping the radiologist find what's going on and make their lives better and maybe catch more things. For AI, I think that's a big word with a lot of different meanings to a lot of different people. I'll talk about, I mentioned Health Tensor, which is a company we're invested in, and they're using AI to help process the data that's in the EMR for patients, and help write the doctor's note, and also alert the doctor to things that they might not have written down or noted themselves. So that kind of assistance, I think we'll see plenty of. We've seen other transcription services, which are also powered by AI. So speakers, or rather microphones that listen in the clinic and take notes for the doctor. That kind of voice or speech to text and speech to semantics is something that is all powered by AI. So there's lots of different ways that AI is going to affect things, and much of it is finding new ways to process lots and lots of data, and whether it's about patients or patient populations, we're going to see lots of it. It's hard to sell to hospitals. It's hard for a startup to sell to hospitals. They're not early adopters. They're big enterprises that are full of bureaucracy. It's a challenging environment, and we see a lot of great ideas from founders that don't survive their first sales cycle. So it helps a lot to get a champion, to get somebody who's inside the system, and that's one way that people have done it. Another way is to not sell to hospitals, to sell to doctors in surgery centers or other settings that aren't so monolithic as these big hospitals. But if you get over that hump, if you get to the place where you've got some logos and some good hospitals under your belt, then sales become much, much easier, because you've kind of broken through. And while these hospitals aren't really early adopters, they are fast followers in a lot of cases. So we have a couple companies in our portfolio that sell to hospital systems, and it was a hard slog, and now it's going really well for them. I think the kind of things that we like, the kind of sort of efficiency through data and AI and these kind of products actually have done pretty well in COVID, because people are trying to figure out how to do things more efficiently, and for economic reasons, and also in healthcare for just logistic reasons. And so I think, like so many things under COVID, healthcare investing has gotten a big shove. So a lot of trends that were happening. Telehealth was already happening, and um, but it got a big shove from the regulatory changes. Uh, I think it, COVID has had the effect of just accelerating a lot of these developments, uh, and so we're finding more.